I beg to move that this House has considered e-petition 598732 relating to the future of the NHS. The petition stated that the government has no democratic mandate to privatise the NHS. I agree. The government has no democratic mandate to privatise the NHS. That's why it's doing no such thing.
No Prime Minister is going to say, and no government is going to say to the public, do you know what? We're going to privatise NHS. Do you know what? We're going to turn it into an American-style healthcare system. Of course they're not going to do that. They're going to manufacture consent for these changes through underfunding and through creeping privatisation.
Over the last decade, we have seen an ideological, intentional attack on our NHS.
Vast sums of public money have been wasted on business managers, private providers, PFI debts, multinational accounting firms and corporate consultants.
Exactly 2 years since the day the first COVID patient was admitted to a UK hospital, morale is collapsing, staff have passed the point of exhaustion and many frontline services are at breaking points. We should not be surprised that the government has so cynically sought to exploit this crisis to advance an agenda of privatisation and fragmentation.
I want to begin by praising all the staff in the NHS who, often at enormous personal risk to themselves, have provided the dedicated care to so many of us over the past 2 years. The Minister must know, and the government should acknowledge, that they're exhausted. As a country, we must now show that we care for them, all of them, as they now turn to address the backlog of over 5 million people waiting for treatment. That means an expanding workforce capacity, both in beds and staffing, to reduce the pressures our NHS heroes are actually facing.
This bill will embed private companies in the NHS in England and give them power to decide who gets what treatment and when.
If enacted, we can expect to see the NHS split up into 42 locally managed health systems, which will be required to balance the books each year, rather than a National Health Service responding to patient need. Following intense pressure from Labour, campaign groups and other stakeholders, the government has conceded that anyone, quote, who could reasonably be regarded as undermining the independence of the NHS because of their involvement in the private healthcare sector won't be able to sit on ICBs. However, such individuals will still be able to have significant influence through a complex array of subcommittees, including place-based partnerships and provider collaboratives. It's there in black and white in NHS guidance, quote, the Health and Care Bill, if enacted, will enable ICBs to delegate functions to providers, including, for example, devolving budgets to provider collaboratives. This exposes the government's real intentions about increasing the involvement of private companies in the running of the NHS.
But what happens when people can't access the care they need, whether it's because of rationing or lengthy waiting lists due to lack of funds, or simply because those with a seat at the Integrated Care System board table determines that their care shouldn't be available on the NHS because it's just not profitable enough? Well, the result is, if a person can't afford private medical cover, they don't receive treatment. It's already happening in NHS dentistry, where it's been normalised. And the risk is that it will be normalised throughout the whole healthcare system.
Some may be tempted by the adverts for private healthcare that we are increasingly seeing, but it's worth taking a look to where this path leads. The average annual cost of health insurance in the USA is an eye-watering $7,470 for an individual and $21,342 for a family.
This new legislation will further dilute the voice of patients and the public, with new boards covering populations of up to 3 million people. They will be remote and centralised, with no obligation to be open, transparent or accountable to ordinary people.
If the pandemic has taught us anything, it should be the importance of public health. Yet the ICBs have no delegated places for directors of public health, or for the mental health, or for adult social services. There's not even a place for the voice of the patient. around whom everything should be centred.
This bill will put on steroids the cronyism we've seen in this pandemic, while our NHS heroes have worked day and night putting their lives on the line. This government has cut real pay for nurses while handing out billions of pounds of contracts through an illegal VIP system to its mates and donors and the failed track and trace system.
None of us could have conceived in 2012 that by doing away with competitive tendering, we might actually see not less privatisation, but more of it. That is, unregulated by the tendering process. In 2012, we couldn't have believed that we would see VIP commissioning routes where contracts for billions of pounds, billions, not millions, were given out in contracts for medical equipment to friends of ministers. But that is what we are facing in this bill, putting that ability into legislation. And that is why this bill should be stopped.
The bill is also includes measures to revoke the national tariff and replace it with an NHS payment scheme. As private providers would be consulted on the NHS payment scheme, it would in effect give them the opportunity to undercut NHS providers. I am very concerned that as a result we will see more and more healthcare being delivered by the private sector rather than the NHS, with money going into shareholders' pockets rather than being spent on patient care. If that happens, NHS staff could see themselves forced out of jobs that are currently on agenda for change rates of pay and the NHS payment scheme, with only private sector jobs available with potentially far worse pay and conditions attached to them.
NHS staff employed by 42 different organisations face a most uncertain future. Casualisation, de-skilling and the introduction of poor terms and conditions. The people of England face a regional, not a national health system, which will have different terms and conditions for its workforce and different provision of treatment. Chaotic, wasteful and irresponsible.
What we now see, and we've seen since 2010, is the increased drive for the Americanisation of our National Health Service. They want to turn it into a system where they feel for your wallet before they feel for your pulse.
The NHS is the jewel in the crown of our public service, our proudest achievement. But 12 years of Tory austerity and now the pressures of the pandemic have stripped it to the bone. An unbelievable £100 billion has gone to private providers of healthcare in the last decade alone. And the last thing it needs right now is a dangerous overhaul that puts the private sector at the heart of a health service.
Underfunding the National Health Service so people can be persuaded to stomach, supposedly, a greater and greater private sector involvement. First, you defund things so people get frustrated, and then you say there's no choice but to hand it over to the private sector.
The bill gives the UK Health Secretary enormous powers over NHS England, over its structure, over its functions and its budget, giving him more leeway during trade negotiations, with particular risks from American healthcare interests. Such ministerial control over NHS England is concerning, as these will have long-term consequences for the NHSs in Scotland and the other devolved nations, particularly in terms of funding and what is included in any free trade agreements.
So there are two futures for the NHS. The disastrous one contained in the Health and Care Bill, or the one that integrates health and social care in an efficient, comprehensive service that is free to everyone from cradle to grave, whatever their medical need, that is delivered entirely in our public sector and accountable, and it's delivered by staff who are fairly treated and properly rewarded.
So let's not beat around the bush. If the Honourable Gentleman and others wish to stop the backdoor privatisation in our NHS, then what they should be doing is opposing the Health and Care Act.
We are determined to embrace innovation and potential where we find it, but that's very different from many of the accusations and speeches we've heard today. But that reflects scaremongering rather than reality, and allegations that this is privatisation by the back door are simply misleading.
The American health insurers are already here. Since 2003, United Health Group, and through its subsidiary Optum, has been awarded NHS contracts across England to provide prescribing decision support software, management of GP referrals to hospitals, and crucially, to implement policy to redesign the NHS.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.